crore population will be inoculated. Dr. Upali Nanda, Head Preventive Health and Consultant Medicine, Medeor Hospital, joining us. Dr. Jagadish Hiremath, Medical Director, Suhas Multi-Speciality Hospital there, to give us more details. I'd like to cut across to Dr. Upali. Take us through what your sentiments are now that the vaccination date has been announced. 16th of January, inoculation drive will begin. You will be one of the first few who will be getting the vaccine. So what is your emotion and excitement here?
Definitely very excited and very happy that we have such a program in place to fight this pandemic. It has taken its toll on humanity. We have been struggling through 2020 with COVID-19, and I'm finally happy that we have a vaccination program which can fight this pandemic and give us hope for the future.
Great. All right, Dr. Hiremath, what's your sentiment? Possibly you too, one of the first in line to be getting the vaccine soon enough. 16th of Jan, how have you and your hospital staff received this news?
Absolutely. We are all elated, and we know that it's going to be a great program and a very successful program, going by what Indian government has already been doing with vaccinations as such across India. So COVID vaccination is going to be for good for all of us.
All right. A few commonly asked questions, Dr. Hiremath, Dr. Upali. I'd like to ask you, this vaccines particularly, both Covaxin and Covishield, both have been rolled out in record period. In fact, Covaxin's phase 3 trials is still underway, and this has raised a lot of doubt among people that since it's done in such short span of time, it's rolled out so quickly, is this bankable? Can I take the vaccine without worrying? Is this safe? What's your opinion as a medical expert?
Well, I think that the Covishield and Covaxin have both gone through stringent scientific measures, and their safety and efficacy has already been seen and decided, and so many scientific journals have also taken part in the peer review. And I think we should have faith in the system. These are companies which have rolled out vaccines which have proved to be safe and efficacious for everyone. And we should have faith in the vaccines and go ahead with the implementation and definitely make a success of this program.
All right, and that's the hope that we all have, that it will be a success. In fact, this is a mammoth exercise given our population. We're the kind of population that the government has to deal with. It's possibly going to be the largest vaccination exercise in the world. Maybe after China, but not sure if they have started as yet. But considering that the government has that kind of exercise to achieve, do you think, Dr. Jagadish Hiremath, the dry runs that have been carried out, including in your hospital, have been largely successful? And what have you picked up from those dry runs?
They have been absolutely successful. See, you have to understand that India already runs a very successful universal immunization program, where every year we inoculate about 2.9 to about 3.4 crore kids, and those who require immunization as per the immunization schedule of India. Along with this, we also have to understand that we are also running one of the best election process across the world. We just saw what happened in US and compare it with the election process which we are going through in our own country. Now we are going to mix this knowledge, use the knowledge of both elections and the universal immunization program to ensure that every person gets vaccination, or at least is told, okay, you have the right to vaccinate yourself.
So you're saying ward level, booth level, to
yes,
enter into really remote areas, the way you conduct elections in those panchayat level, that's the procedure you're going to use to even reach out to the public at large. All right, that's excellent. Yes. But considering that the dry runs have been successful, here's you did mention that 3 crore odd children get vaccinated, but this is for the entire population and it's in phases. Do you think the government, in terms of actually collecting information, will be largely successful in collating the data? From your hospital, how have you really registered with the government officials saying that these are the number of people from our end who need to get vaccinated? Have you